Located at the base of the Chamundi Hills, about 150 kilometers away from the IT capital of Bengaluru, is the city of Mysuru. Popularly known as the pensioners' paradise, this is one of South India's most famous tourist destinations. While Mysuru still boasts of its boulevards, heritage structures and historical grandeur, the story of this quaint city is quickly changing. Rapid urbanization and indiscriminate expansion are slowly but steadily spreading their roots into Mysuru. Changes in the region's demography and economic landscape are also resulting in parallel shifts in the health and lifestyles of people. Mysuru is now in an unforeseen race of being one of India's 20-plus urban centres like Allahabad, Patna, Agra, Meerut, Gurgaon and Srinagar, with an increased burden of non-communicable diseases or NCDs. 8.1% of Mysuru district's population are living with cardiovascular conditions. 12.7% suffer from diabetes and an alarming 25.6% suffer from hypertension.
टेंशन ಮಾಡ್ಕೊಂಡ್ರೆ ಶುಗರ್ ಏರ್ಕೊಂಡ್ಬಿಡೋದು ನಮಗೆ 130 ಇದ್ದದ್ದು ಈ ಟೆನ್ಷನ್ 250 ಆಗ್ಬಿಟ್ಟೈತೆ ಈಗ
जब ब्लड प्रेशर मेरे को शुरू हुआ था मैंने उसको रिड्यूस करने के लिए काफी कोशिश किया था मगर कंट्रोल में हो नहीं पाया
ಈ ಶುಗರ್ ಬತ್ತು ಅಂತ ನಂಗೆ ಯೋಚನೆ ಇಲ್ಲ ಆದ್ರೆ ಶುಗರ್ ಬಂದಿರೋರು ತುಂಬಾ ಚೆನ್ನಾಗಿದ್ದಾರೆ ನನಗೇನಕ್ಕೆ ಹಿಂಗಾಯ್ತು
KHPT, with the support of the Government of Karnataka's Health and Family Welfare Department, Mysuru City Corporation and Medtronic Foundation, is implementing a unique community-based pilot project. This pilot covers one urban primary healthcare centre of Mysuru called Kumbarakoppulu, having a population of 60,000, largely belonging to low-income and scheduled caste groups. The success of this pilot can potentially offer India a continuum of care model for NCDs that works in similar urban settings.
ನೀವು ಇನ್ನೂ ಹೆಲ್ದಿ ಆಗಿ ಈಗ ನಾವೆಲ್ಲ ಪೇಷಂಟ್ ಸಪೋರ್ಟ್ ಗ್ರೂಪ್ ಎಲ್ಲ ಮಾಡ್ತಾ ಇದೀವಿ ಗೊತ್ತು ತಾನೆ ನೀವು ಬಂದು ಹಾಡೆಲ್ಲ ಹೇಳ್ತಿದ್ರಿ ಅವಾಗೆಲ್ಲ ತುಂಬಾ ಆಕ್ಟಿವ್ ಆಗಿದ್ರಿ ಅಲ್ವಾ
The pilot currently reaches 1,800 patients, of which 46% of those with diabetes and 41% with hypertension have achieved clinical improvements so far. Large-scale screening and awareness activities has led to an increase in footfalls to the health centre from a mere 120 to 2,300. The pilot interventions focused on providing accessible, patient-centred care for NCDs at first contact through 6 components. We developed, trained and empowered group of community health workers or CHWs who deliver customized care for people with diabetes and hypertension. The CHW's dedicated reach helped these patients adhere better to treatment protocols and regularize their visits to clinics.
ಪೇಷಂಟ್ಸ್ ಅಂದರೆ ಅವರನ್ನು ಮನೆ ಮಗಳಾಗಿ ನೋಡ್ತಾರೆ CSW ಅಂತ ಅಂದ್ಕೊಂಡೇ ಇಲ್ಲ ನಾನಾಗಿನೂ ಅಷ್ಟೇ ಅವರಾಗಿನೂ ಅಷ್ಟೇ ಒಂದೇ ಒಳ್ಳೆ ಬಾಂಧವ್ಯ ಇದೆ ನಮ್ಮಿಬ್ಬರ ಮಧ್ಯ ಮತ್ತು ನಾನು ಮುಂಚೆ ರೋಡಲ್ಲಿ ಹೋಗ್ಬೇಕಾದ್ರೆ ಯಾರೂ ನನ್ನ ಗುರ್ತಿಡಿತಿರ್ಲಿಲ್ಲ ಇವಾಗ ನನ್ನ ಗುರ್ತಿಡಿತಾರೆ ತುಂಬ ಸಂತೋಷ ಆಗಿದೆ ಈ ಕೆಲಸದಿಂದ ಅವ್ರಿಗೂ ಅಷ್ಟೇ ಸಂತೋಷವಾಗಿದೆ
जो हमारा जो कम्युनिटी हेल्थ वर्कर अश्विनी मैडम जब इधर आया था आकर के पर्सनली आकर के हमारा घर में हमारे को मीट करने के लिए आती है और अच्छा एडवाइस करती है और एक इन्होंने किताब KHP उनका तरफ से एक बुक दिया हुआ जो डिटेल हमारा BP चेक किया वो बुक में वो एंटर कर करके जाती है ये सब कुछ उसने जब मेरे को बताया उसका बात का मुताबिक मैंने क्या किया वॉकिंग करना शुरू किया जब मैं कंटिन्यू वॉकिंग कर रहा हूँ 3 किलोमीटर सुबह उठ करके वॉकिंग करके लाइट एक्सरसाइज करता हूँ घर में एक्सरसाइज करने के बाद एट प्रेजेंट मैं मेरे को खुद फीलिंग हो रहा है आई एम फ्लेक्सिबल मैं इजी से जा सकता हूँ आ सकता हूँ दौड़ कर सकता हूँ काम कर सकता हूँ घर में
The pilot has created community support groups, which are informal platforms where patients and caregivers come together and offer emotional support to each other, especially since dealing with the disease is often a tedious, lonely, and stigmatizing experience for many. We have built community advocates among patients and have empowered them to be facilitators and drivers of change at the local level. These community advocates inspire other patients with their stories and motivate them to adopt healthy behaviors and positive attitudes.
ನಾನು ಅದೇ ರೀತಿ ಸಫರ್ ಬೀಳ್ತಿದ್ದೆ, BP ಜಾಸ್ತಿ ಆಗಿ ಸಫರ್ ಬೀಳ್ತಾ ಇದ್ದೆ. ಈಗೆಲ್ಲ BP ಮಾತ್ರೆ ತಗೊಂಡ್ಮೇಲೆ ನಾನು ಆರೋಗ್ಯವಾಗಿದ್ದೀನಿ, ನಾರ್ಮಲ್ ಆಗಿದ್ದೀನಿ.
The pilot has leveraged technology platforms for customized patient outreach. These platforms ensure real-time data monitoring and act as a bridge between facility-based and community-based patient data records, helping CHWs prioritize patients for tailored care services. The pilot has also set up health camps to bring services to the doorsteps of people. These camps improve access to care for vulnerable groups and offer testing, counseling, and treatment services in a patient-friendly setting. This pilot project engages in health system strengthening, especially through coordination with the primary healthcare center and its functionaries, as well as the private sector, through strengthening diagnostics and protocol-based care to offer seamless support to patients. The project has been able to generate interest among wider stakeholders for its comprehensive approach to NCD care at primary care level in urban settings. NCDs are an emerging public health need, and our vision is to demonstrate a successful model for population-level impact by placing the patient community at the center and thinking at scale. With the success of this model, India can tackle the challenge of NCDs in its fast-growing Tier 2 urban centers like Mysuru.